at the next badge, you remember that on Thursday, last week, we had the first 8 aspects of it, where we talked about CPR, and then we looked at the different first aid measures that we can take in certain situations. And I did also say that it's important for all health workers to be CPR certified, to know how to carry out CPR. And we learned a couple of things last week too. But before we move into what we actually want to do, because like I said, I'm a teacher, so I have to evaluate. I have to ask 1 or 2 questions, or just 1 or 2, so I can actually know if you learned anything last week. So who is going to set the ball rolling? My first question goes, what's the full meaning of CPR? What does CPR mean? And when are we expected to carry out CPR? At what instances or at what situations are we expected to carry out CPR? Who is going to help us? So,
okay, Ma, Helen speaking, Ma. Helen speaking, Ma. Helen. Hello.
Go ahead.
Can you hear me? Can you hear me, Ma?
Yes, Helen, I'm with you. Please go ahead and answer. Thank you.
Okay, Ma. CPR simply means cardiopulmonary resuscitation. That's the meaning of CPR. Can you hear me, Ma?
I guess it's network. Cardiopulmonary. I didn't hear the last, Helen. Helen, are you there?
Resuscitation. Yes, Ma, resuscitation.
Network.
Cardiopulmonary resuscitation, Ma. Can you hear me?
Yes, I can hear you. Thank you, Helen. Thank you for not making me sad, because I was thinking nobody will be able to give me, nobody is going to be willing to give me answers to this question. So thank you, Helen, for setting the ball rolling. Cardiopulmonary resuscitation. Yes, cardio means.
Yes.
Go ahead.
Yeah. Cardio means the heart. The cardio refers to the heart. Cardio means the heart.
Okay, cardio means. All right. So who else?
The heart. Then the pulmonary means the lungs.
The lungs. Okay. Thank you. Pulmonary. Thank you so much. I think I don't know if it's. Okay. Can everybody hear me? Who else is going to? Thank you so much, Helen, for that response. Cardiopulmonary resuscitation. That's the meaning of CPR. Okay, I asked another question. I asked to know at what point are we supposed to carry out CPR? At what point are we supposed to, or which particular situations or scenarios are we supposed to carry out CPR?
In a situation when one is drowned, situation.
Okay, in a situation where one is doing that correctly. I'm trying to. I can't hear you clearly. But I guess you said in a situation where one is.
Maybe the heart beat. Maybe the heart stops breathing.
When the heart stops breathing.
When the heart stops breathing. Can you hear me?
Good evening.
Thank you.
We carry out CPR when we can find the pulse, and maybe when the person is not breathing, but we can feel the pulse.
And
okay.
When there is no pulse,
thank you. The only thing is I don't know what is happening, but I can't most of the people responding. So, well, It's very important. Hello.
The network is not funny here.
Please, I need to hear. I need to know if any at all.
We are here. Is the network?
We are here. The network is not friendly, ma.
Okay,
The
then you can.
network is bad. But we are here. I'm here.
Okay, I know what I'm saying. If everybody can hear me and can unanimously maybe respond, I hear that you can hear me, then I know the net is not mine, because so many of the responses I couldn't hear. So I'm wondering if
We are hearing you.
so, maybe we'll just see. All right, thank you. If network favors us, we'll do the questions at the end of the day. Let's see, delve right into what we have and see if the picture quality would be okay. So, all right. So this evening we are going to be looking at we are going to have, like I told you, with the first aid. So this evening we are going to have the clinical aspect of it, and as we talked about in infection control and prevention, we had said that the best way to guard against contacting infection, maybe spreading infection to your patients or to your clients or to your casualty, and you also contacting infection, then you have to follow laid down procedures, laid down processes, or as to how to go about taking care of those people that are in your care. So at this point, there was what I had said earlier, that is the best way that we can control infection. We can control the spread of infection. We can guard against the spread of infection. So this evening we are going to be learning from a specialist in that field, a nurse. Please come.
She's still talking.
You cannot start your video because the host has stopped it. Please check. Rules that are involved. We had said in order to make us have a picture quality, let's mute our mics, please. Only when we need to talk, maybe towards the end, we will be required to talk, maybe ask questions or at any point. So anybody that unmutes the mic disturbs the total picture quality. That's how it has been. It's still the same thing as last week. So I believe that we'll all adhere to that. If I go, are we together?
Yes, ma'am.
Yes, ma'am. Yes.
Okay, please let's try. You know, we had a network issue last week too. It was better, so we hope that live as we come. Working with us, Abigail, she's going to be showing us some of the techniques required and the things we need to do in the course of showcasing our skills as certified health.
Abigail, thank you. Good evening, everyone. Good evening.
Good evening.
I guess you can hear me. My name is Abigail Bassi. I'm here to take you participants on the practical aspects of certified healthcare assistance. So now we are going to start with proper hand washing.
Yes, if they can see, you need to also find out if they can see. Okay, you are seeing.
Can you see me?
Yes,
So
Yes,
we are
ma'am.
starting.
Yes, ma'am.
I can see. Yes, ma'am.
Okay. First of all, I'm going to wet my hands. And I open the tap this way. And I close it this way. Then I apply the soap.
Ma, we are not seeing, ma. Not seeing.
Okay. Can you see me now? Okay.
Okay,
So first of all, I said I wet my hands. Then I apply the soap. After applying the soap, I rub this way,
We are not seeing again. The thing has gone.
palm to palm. Then I use my left hand to rub my right hand. After that, I use my right hand to rub my hand this way. Then I use the tip of my fingers to wash my hand this way. Then I also turn it this way and wash the way. After that, I interlock my fingers. I wash this way. Can you see me? Okay.
From
Hello. Are we
from
together?
from the second step. No.
Hello.
It's not
It's
showing.
not showing.
It's not showing at all.
Not showing, no.
The video,
please hold on a second.
the screen is blank.
Please hold on. Let's see. I don't know what's right to it's like. I also it will be better for us with network. Okay, please let me ask them. Please, I need to know, I need your feedback so we can help you better. Is it clear enough now? Can you see us? Can you see her? Can you see us, Abigail?
Yes,
I can see you now. Can see you
Okay.
now.
Let's start all over.
Yes.
So first of all, I wet my hand, opening the tap with my elbow this way, wet my hand. Then I close the tap this way. I proceed to apply the soap on my arm this way. After that, I rub my hand palm to palm this way. After that, I turn my hand this way, the back of my hands, interlocking it, and then washing this way. Then I put my thumb this way in a circular movement this way. Then I use my left thumb, put it this way, and then I wash this way.
We are not seeing very well, though.
Can you see?
It has gone off again. It's blank, totally blank again, ma. The screen is blank. We are not even seeing you.
Because other people are turning on their mic. That's why all of us have to mute our mic.
No. It's when I want to talk, I turn on my mic. Oh. Like now, the screen is blank. I'm not even seeing you.
No. When other people are talking, the thing will be blank. If everybody should meet their mark, it will be clear.
Okay. Hello, everyone.
Just take it gradually. I'm observing the network.
Okay.
To buy time, just busy them a bit.
Okay. I don't know why today is like this. So sorry about it. It's network. We actually are using a 5G router, but I don't know what is happening. Not favorable, and I guess it's not. We cannot just schedule it for another day. Let's go ahead and do what we have to do. Please, are we able to go?
Yes, ma'am. It is clear now.
It has gone blank again.
It's not blank, it's on top of your screen. Because they're talking, if you're mute,
Okay, can we mute?
it goes off your screen. Check.
My screen, I mute.
Hello, everyone.
Okay, please, let's mute our mics as we progress. Any side you don't see could be network, just mute, because if any mic is on, that's the problem we always have. If your mic is on, it's going to disrupt the total network for people, for everybody, because it's one Zoom account that we use as in one. So please, let's mute so we can be faster. So, okay, let's maybe we recap so that we start for them to see the first thing to do.
Okay, the first thing to do is to on the tap this way. Then wet my hands. After that, I close the tap this way. Then I apply the soap this way. Afterwards, I rub my hands this way, palm to palm. Are we together? I rub my hands this way, palm to palm. Then I wash the back of my hand this way, washing in between the fingers. Can you see? Using the tip of my fingers, I do this way. Then I turn to my right arm. I do this way. Are we together? Then I rub my hand this way. After that, that's this way. In a circular way, I do this way. Then I turn my left thumb and I scrub this way. Are we together? After that, I now rinse my hand by opening the tap this way with my elbow. Then I rub my arm this way. This way. Allowing the water to flow freely. I do this way. Afterwards, I now close the tap this way. Then I dry my hands this way.
Can you see that?
Can you see that?
Thank you, Nosabidia. Sorry, we have this network issue. I just pray that we get better, maybe as we progress. So are we together, please? That was the first part of the practicals, the very first, which is proper hand washing. That is very important to guard against infection, for infection control and prevention. So what are the practical together? Can you hear me? Is it clear? Can they hear me? Can I go ahead?
Right.
Can you hear me, please?
Yes, ma. Yes, ma, we can. Very clear.
Okay. All right. So if it's not clear, then maybe it's not our own network because we've actually done everything necessary thing. So what's the first step to do when washing your hands, just as Nurse Abigail has shown us, is to open the tap. The reason I'm taking time, I want to recap what Nurse has just done, is so that you'll understand. Hand washing is very important, and over the years with the CNA certified nursing assistants, caregiving, there is no way you run away from questions coming from hand washing. So it's very important because you would have to carry out a video for like 3 to 5 minutes showcasing any skill. So if you pick hand washing as one of the skills that you are showcasing, then you have to be very, very vigilant. And of course, whether you use hand washing as one of the skills you showcase or not, it is one very major important aspect of health, okay, or patient's care. So the first thing we saw her do, I'm trying to recap because network maybe did not permit some of us, is opening the tap with her elbow. On no account should you use your hand to open the tap. Well, even if you use your hand to open the tap, you should not use your hand to close the tap because as at the point you are opening the tap, you want to wash your hand. So when your hand is effectively cleaned, you should not use that same hand to close the tap because very, very things spread germs and make the spread of germs to be very, very effective, especially in a confined setting. So after that, which we saw, you wash the hands properly, interlock, wash in between your fingers, very important. Wash your wrists, your fingers, your elbow, if possible, wash down, wash very well, and then rinse it, just as we have seen. So I don't know, afterwards, you can decide to clean, just as Nurse Abigail showed us, or you decide to air dry. Any of the two. You can air dry. You have the air drying facility, air dry. If not, you can just use a serviette, a clean to clean. And then you close the tap with your same elbow. So I don't know if we have any questions. Don't worry, as we progress, it's going to be clearer just as it happened. I think it's trying to stabilize. As we progress, we have less network issues. I just pray. So based on that, do we have any questions to ask Nurse Abigail? Is there any parts you don't understand or you want to ask any question? We are going to be taking it slowly, step by step, to ensure that we carry everybody along. Are we together?
Yes, we are.
Perhaps I've just been busy talking to myself, or Nurse Abigail has just been busy talking to herself. That we should mute our mics does not mean we shouldn't rest. When it's time to speak out, then when you are done, we can then continue. It's important that we get response because this is an online thing. So if you don't respond, I can think I am doing something, and at the end of the day, I'm busy doing nothing. That's why the response is important. Please. So are we together? Can everybody hear me?
Yes, we
Yes,
can
ma'am.
hear you, ma.
Because I
Okay,
starting.
so what part of it? I don't know. I just that. Do we have any question? Or do you need us to give a replay of that hand washing? Should we have a replay of it?
Yes, ma'am. Yes, ma'am.
All right. We are going to have a replay of that. So just watch us, Abigail, do it. The first step, you know why I'm stressing this thing? You know, I am into this training business, the health sector. So I have seen so many people, their marks, when they do videos to submit, they lose marks. Even when they do the professional exams and they perform well, the computer says you had 94, you had 100. At the end of the day, you are going to have to add your video scores. So, and what are the things they look at for those strategic steps that are very important? So for hand washing, like I said, the very first step of hand washing is you opening the tap this way. Just do the action out. Then you open the tap.
I wet my hands. After that, I close the tap this way.
With your elbow, not with your hand. Remember, these are things that are very, very for us to learn. Go ahead.
Afterwards, I move to apply the soap on my hands. So I do it this way again. I open the tap and then wet my hand again. Then I close it. After that, I rub my hands palm to palm this way. After that, you use the tip of your fingernails. Do this way. So wash your palm in a circular movement this way. After that, you use the tip of your left hand and then wash your other palm this way. Same movement in a circular movement. After that, you now turn to the back, interlocking your hands this way. Then washing in between your fingers this way. After that, use the left hand to do the same. Then you wash also in between your fingers. Then you wash your wrists this way. Are we together?
Yes.
After that, you turn to the right wrist using your left hand. You wash this way. Then you now rub your palms this way again. Then you open the tap this way again. And then you wash your hands. Allow the water to flow freely. Then you put this other hand this way. Then finally, you rub it this way. Can you see?
Yes, I think.
Are we together? Then you now close the tap this way. Then you pick your serviettes or the hand towel and then you dry your hands.
Thank you so much, Dr. for explanation. So the first thing, you have seen the first step, and then the second, the movement is very important. The way you wash your hands, interlocking them, rubbing them in a circular form, using your finger, rubbing, and making sure, because we know that germs are spaces like this, fingers, and so on. So thank you so much, Nurse Abigail. What I think right now is the proper way that you can don and doff gloves. You know, gloves is like Bible is to a Christian, the use of the Bible every time. So your hand gloves for a health practitioner, person that either a first aider or a worker or a health practitioner, your hand gloves should not be far from you, because most of the things you do, your duty needs you to be well kitted with your PPE, that's personal protective equipment. Thank you, Mildred. That's so that to help us, just as we keep going, just drop your question, type it in the chat box. We are on it because network is actually not very friendly. All right, Mildred. Mildred, please go ahead. Thank you for your question.
Okay. Can I ask the question? Okay, my question is this. I'm seeing that tap, that you use your elbow to open the tap. The question I want to ask, if that is the head of the tap is not this way, because I've been to a hospital where you need to press for the water to start coming up. It doesn't have this kind of tap.
Wow.
You can't use your elbow there. You use your finger. You press it coming up. So because using elbow, what I've seen, it won't work there. Thank you, ma'am.
Thank you for that question. The reason is this: I actually anticipated that question, but I was almost getting sad that nobody wanted to ask that question. Most don't have those type. They have maybe the right elbow. No matter how you use your elbow, you cannot just get it. So thank you for asking that question. Okay, Nasabi.
Okay, let me respond to that question. In a situation whereby you don't have a tap that has this handle, I think for you to do is to put a serviette. Or if there is no serviette, you can use a tissue paper and then open the tap this way. After that, you drop it. Then you wet your hands. After which you now close the tap this way.
Thank you. Thank you, ma'am.
Are you okay?
Yes, I'm fine. Thank you.
All right, Mildred, thank you for that question. So practically, it's not all the taps that have the type that we know. So we can use the serviette. It's very easy to use the serviette to do that. Even if it's the other tap, there's still another kind of tap that is circular inside. It's just like the toilet when you want to flush some water system comes like that. So you can still use your elbow to press in and then the tap. But if you don't have such, reach out for your serviette and disposable. You know, serviette is disposable. As soon as you are done, you discard it to avoid rid of infection. So thank you. That's been answered. Do we have any other questions? Tell us for me. If there's none, okay. So please just kindly type it. We are on the chat box so that we move. If network gives us the grace, we just keep moving. Let's ask the next question. There's another question.
Can't one get infected using your elbow too?
All right. Thank you for the question. Who asked the question, please? Let's see.
Pedro,
Okay, Temi Tokwe asked that question. That can someone be affected? I mean, infected by using the elbow? Okay. The easiest part for you to contact infection is your hands. Because there's virtually nothing you do without using your hands. So when we are talking about infection, it's very rare before your elbow gets in contact with the patient. It's very rare before you have that elbow contact with the patient. But your hands are more prone to. Your elbow all through this side is more prone to you. Prone to being and use it in the course of you carrying out patient care. Your hands is most vulnerable to infection. Hence, we are really emphasizing on this is less than 5% for you to spread infection through your elbow. That's why again, for you to buttress what I have just said, in some settings like we are going to look at today in the practicals, when you cough and sneeze, you are not advised to use your palm. When you cough, you're not advised to use your palm. When you sneeze, you are not advised to use your palm. You are advised to use your elbow. This, let's see. You are advised to use your elbow. You just sneeze. You form your elbow, give it a greater than sign, and you sneeze inside or you cough inside. You still the elbow. So why is it so? All right, so that having said, please, is there any other question? Me, I want to do justice to it.
But the end is fine. It's fine. If you want to be in the morning, you have age control. Brushing it. I'm going
Someone the dust mites that are not muted are actually the cause of this fluctuations. Because when your mic goes off, it begins to dance. Okay, so now we are going to, can we proceed? We want to look at proper developing of hand gloves. Over to you.
Okay.
Yeah.
Let's start. You can see this is our sterile glove. I open from this side. I tear it open from this side. Then I go this way. Are we together? Can they see me? I open it this way.
I know you. Let me come closer. I'm trying not to move the camera of the network strength.
Okay.
So what you're doing, is it possible to come closer?
Okay, let me use of this game.
Yes. Sorry, let's
Okay, just hold on. Don't worry. Don't worry.
Okay, so that it will be closer. This position, so that we can see exactly everything better. Yeah.
Okay,
Right.
I said this is my sterile glove. We want to go into the donning and doffing of gloves. So I tear it open from this side. You can see where it's written, tear open from this side. Then I now open from this side.
Forests have been charged by the Football Association every following a pitchside altercation during Sunday's friendly withdrawal. The incident occurred in the 88th minute when Nottingham Forest Michael Williams challenged Chelsea's Mark Cucurella, sending him
Mute your mic.
You see, this is it. At the end of the day, the only problem is that people that you have to suffer for other people's. I don't know. That's how this technology thing is. If you don't if you don't mute your mic, it becomes a problem. It disrupts everything. I've said it over and over again.
Okay, let's start all over again. This is my sterile glove. I open it. You can see where it's written, tear open. This is the place you have to open it from, this way. Then you tear it open from the side, this way. So we go this way, open it. The main aim of opening it this way is to prevent contamination. So you don't touch any place inside the gloves. So I'll go this way, open it this way. Can you see? Open it this way. Are we together? Then I open it this way. Are we together? Then I open it this way. So the glove is now open. In order to put on this glove without contaminating the gloves, you try to align your fingers in the proper way, which I'm about to show you. This way. Align your fingers. Can we see? So I've successfully worn my gloves, my sterile gloves on my left hand without touching any parts of this sterile gloves. So now I'm going to put on these gloves this way. You align your fingers. Sometimes these gloves are like this one. So since it's a bit difficult, I'll go this way. Are we together? So you can see I did not touch any parts of the sterile parts. So this is how to successfully wear your sterile glove for any sterile procedure. So now we are going to the doffing of the gloves. We are to assume that I'm done with my procedure. So now I want to remove my gloves. This time around is for me to prevent any contamination coming from the patient's fluid that touched the glove. So now I go this way. I just pinch the glove this way and then remove it. Can you see? Then you come this way. You put your finger this way and then you remove it without any fluid coming in contact with your face. As simple as that. So I'm done. Then I will discard my glove in the waste basket. Thank you. Thank you so much, Nurse Abigail, for that beautiful demonstration. Now that's another very important aspect. We finished talking about the hand washing, and now we've just seen the proper donning and doffing of gloves. All the steps. Practically, I had to actually appeal to Nurse Abigail to take it very calmly. That's you should take it gradually, so everybody can get all the pieces. So that if you have to do a video, we'll not have some, would have it very correct at once. So that's what we have just finished doing. It's very important that you know how to wear, you know how to see. Help people that work in the health sector. It's as easy as ABC for you to contact infection. It's as easy as anything. Just one little mistake, like we have been talking about, just one little act of carelessness can metamorphose into something else. So it's important we know how to wear the gloves and how to remove the gloves. So we will also look at we'll also look at the nose mask. Okay. Of wearing and removing the nose mask to avoid spread of infection. That's another thing. Remember during that COVID era where we had to do a whole lot, they say use your nose mask, use your face mask, and people were using it wrongly. Actually, most times you see people just remove and wear, so long as they have fulfilled all righteousness, so they've done what they have to do. That's pardon? Yes, there's a question. Thank you for those that are actually adhering, dropping it in the chat box. What's the question, please? Okay, must it be necessarily this type of gloves because there are some inside carton? Okay, yeah, depending what's the
who is asking, Aminat is trying to ask. She's saying that must it be this type of gloves? Can we use other types of gloves? Or it has to be this like latex gloves? I think this is latex.
Yes.
Okay. Can we use any other type of gloves?
Yes, we can use any other type of glove.
Okay.
The main thing there is for you to wear it the proper way.
So you can
Yes.
use the latex and use the ones like that is referring to that is in cartons. I don't know, maybe in some of them in boxes, some of them in cartons. So I think you can use like she can use other kinds of gloves, but you have to be careful as to how you wear it. It's very important. You have it and some gloves, depending on the procedure that you're actually going to carry out. The kind of gloves to wear, because I think Nosabi wear the cotton gloves. No, that one is the one we use for ballet.
Yes.
No, we cannot wear that one. Yeah, so I think mostly yes. Or we also have another type too, the improvised, the ones that the red first aiders use, like we saw in officer's first aid box. That one is just like the polythene bag where you buy, put bread into it. So some can be like that. In a situation you don't have the latex gloves, you know, guard against infection, you can just open your first aid box, which I advise that we need to have as healthcare practitioners. We can just use that light gloves and it serves the same purpose. So Aminat, I guess that question has been judiciously answered. Do we have another one? Okay, she's saying that the one in the box that hands can touch them when trying to remove. It depends on which type of glove she's talking about.
Okay, is it exam glove? Is it disposable gloves? Which glove are you talking
She's saying
about?
the ones in the box. There's no name stated any name, but however, whether it is in a box or it is out of the box, the most important thing is for you to, as much as possible, reduce you touching surfaces. And if you must touch surfaces, you have to wash your hands afterwards. If you are touching the carton, if it's, I guess must have been there. It is the gloves inside the carton. If it is removed from the carton, you can wash your hands. Yes. You can wash your hands or use the hand sanitizer. You can wash your hands, you can use the hand sanitizer. I think that's easy to ensure your hand is okay before you actually carry on with the process. So I don't know if that's okay. You can just indicate if you are okay with the answer to the question, because network is being funny. So let's move to the next step and see.
So now we are moving to the next step, which is the proper way of wearing nose masks. So this is,
we have to, I think they can't see. Can we move it closer?
You can see.
They can see, okay.
So this is my nose mask. Let's assume it's sealed already. So I will open it from here. Are we together? On this side. Then afterwards, I open it from this other side. Without touching the nose mask.
Recording in progress.
Are we together? Can we see? So there's something on top. I'll just keep it this way aside. So I pick my nose mask this way. And then hold it this other side at the tip. So I apply it this way. Are we together? Then I hold this way. Can you see? Then
You have to restart the property.
I think we break. So you need to take it from the start. if possible, you can use the other one so that they can see from the start.
So,
yes.
okay. This is my nose mask. I'm about to show you how to wear it properly without contaminating it. So, okay, this is my nose mask. I'm about to show you how to wear the nose mask properly without contaminating it. Okay. Can you see me? Hello, everyone. Can you see me?
Yes, ma'am.
No.
Okay.
No. Okay. Yes. I see you now.
See me now?
Okay.
Yes, I can
Like I
see
said,
you.
this is my nose mask. I want to show you the proper way of wearing nose masks without contaminating it. So, okay. Okay, I open it this way. Are we together? Then I go this way. Here. So can we see? You can see. So I sanitize my hand. Are we together? Okay. Thank you. Thank you so much, Nasadia. See that. Proper way to wear nose mask. Like I want to add during that COVID time, most of us that had that experience during that time, you know, all we needed to do was to be compliant, you know, wear the gloves, wear everything properly and to fulfill all righteousness, you know, but it's important we know how to wear it. We should not avoid any interface. Avoid any interface that allows you to touch the outer part of the nose mask to avoid infection or cross-contamination. Thank you so much. So any question? Do we have any question? Please, if you have one, just like it's on the chat box. I'm looking at it, we'll address it. Because if we say maybe on mute, perhaps we are trying to see how to handle the network. So do we have any question? Time for questions concerning the nose mask. After which
If there is none, so do we have, can we proceed? Okay, but at the same time, yes, someone wants to ask a question. Thank you. Please let us know what the question is.
Okay, let me see.
You. Okay. All right. Promise. Thank you for letting me know that we are together. How about in a situation where there is an emergency, where there is no water to wash your hands before wearing your nose mask and hand gloves? You said it. You said it already. And if there is a situation, of course, like we talked about emergency response the other day, we said that emergency happens when you don't prepare for most times, maybe as first aid, you know. So if you don't have the hand gloves, which as a first aider now you should have, you can decide to use your hand sanitizer. So you shouldn't do without as a first aider or as a healthcare practitioner, you should ensure you have the small hand sanitizers, especially the alcohol-based ones. Those are the ones, you know. So when you want to buy a hand sanitizer, look out for that particular part. Let it be an alcohol-based. So they are small. We have the smaller ones that are very portable. So if you don't have the hand gloves, you can decide to use the hand sanitizer when the need arises or when you have an emergency. That is it. Thank you so much. Temitope already answered. You sanitize. And you can also use spirit. That's correct. You can also use spirit on your hands too. Anything that at that point of an emergency, you have any disinfectant, you have the you cannot wash your hands, you have the hand gloves. Very easy. You just make use of it, sanitize your hands. But despite the fact that we've been talking about sanitizing, that's like having an option B. The most important thing to do, the most important tip is continuous and constant hand washing. When you have the opportunity to, don't be tired of washing your hands. Just keep washing your hands, just keep washing them, because so that you can, as much as possible, reduce infection. That's the best option. But to have like an option B where there is no gloves or where you can't wash your hands, then you sanitize. Thank you so much. Infinix, I think that should be Helen and Temitope. I am really eager to hear Ezinwa. I've not, that name, I tried to just think today. I've not heard Ezinwa Loretta. Yes, Ezinwa Loretta. Please, if you are here at any point, I would like to hear your voice today before I leave. Because that name, I mean, that voice or name, I don't know, I'm trying to place it if I've heard your voice we started. You know, I just have today and tomorrow, and I have to ensure that these 2 days, I hear everybody's voice. If I don't hear your voice in the training, I'll give you a call so that I'll find out why I didn't hear your voice today. So please, who else? Ezinwa is one. Then Lucy, Nandi, please, if you are here, to let me know you are here. You are from Ghana, I guess Ghana or Liberia. So let me at least hear your voice. Madam Sarah too, as well as others. Thank you. If I don't hear your voice, I'll reach out to you. Okay, so now we want to look at, we are moving. Thank you for the questions and for the beautiful responses. We are going to move now to another step that is important. As a certified healthcare assistant or a health worker, it is important that you know how to do these things. They may seem little or, you know, but those are the things they look out as the skills you need to have eventually in the workplace when you get face to face. So we want to look at how we can make an unoccupied bed. It is one of the skills of a certified healthcare assistant or a certified assistant. Most people in the health setting that are not actually that are not doctors, that is one skill that you need to know, because you have to ensure that your patient's bed is made all the time. That's why when you enter some hospitals, I mean, you just see the beds at a glance and you know that yes, they're actually working. So let's see. how to make an unoccupied bed. Over to Nurse Abigail. Thank you.
Okay. About to make an unoccupied bed. First of all, know that bed is made for the comfort of the patient. Once the bed is neat and well arranged, the patient will be comfortable while sleeping. And also, bed is made for aesthetic reasons, which we all know. So now I'll proceed. What I'll do first of all is to wash my hand. Like I told you, wash your hand before and after any procedure. So I'll go by opening the tap, wet my hand, close this way, then I'll apply the soap. Rub palm to palm, back of my hands, and then this way. After that, we shall open the tap little and then rinse my hands. After that, I close this way and then I dry my hand. So let me gather my supply. Okay, I see you. That's not far. Yes, not see. I think we need to come a little bit closer, please. Just closer so the view can be sharp. Okay. So first of all, these are my supplies. So this is my top sheet. And then this is my raw Macintosh. This is my raw bed sheet. And then this is my bottom sheet. Which I'll turn it this way. Are we together? So I will strip the bed. Strip the bed. Okay. We have to do so that they really want to see that. So I'll discard it in the linen with me. Okay, please, sorry to call you. Nurse Abigail, something I saw you do when you moved it. Do they need any tips while removing the bed sheets? Yes. So they don't yes. So I don't want anyone to be infected. Thank you. Okay, you not allow the sheet to come in contact with your scrub. Right. So as to prevent infection from the soiled linen, and then also to prevent to the bed while placing the new bed sheet. So you strip the bed from top to bottom, and then after which you discard it in the soiled linen bin. Thank you. Thank you so much. So now I'll proceed. My bottom sheet. Or you have top sheet. You know that that's the something I want to put something to write from this one. So now this is my bottom sheet. Are we together? Are we together? This is, so I'll open it this way. Spray it equally on the bed. From top to bottom. From side to side. Make sure they are all equal. By doing it, make sure your scrub doesn't come in contact with the sheet. So after spraying it equally, I will now make the bed. You carry the bed this way. And then to drop it back. There's what we call envelope corner. Whenever you want to make a bed, you make the envelope corner. The envelope corner is very important when making a bed because that's where the parent keeps his or her belongings. Example, earring, hanky, whatever she feels like, she puts it in that envelope corner. So you put it this way. Can you see? Then you tuck in this way. Are we together? After which you bring the triangle this way. Can we see? You bring triangle shape this way, and then you make the envelope corner, which you now tuck it in. So you come here, you do same. Tuck it in this way, then bring this triangular shape to make the envelope corner, which you tuck in like this way. Are we together? Can we see? Then you bring it down this way. And then you tuck it in. Can we see? Okay. You do things this way. And then you do things also this way. So now I'll take a draw hand. I'll spread it equally. Can you see? Yeah. I'll
Not you may. I want to read, you know.
then I come to this side and then I talk. After that, I'll pick my draw sheet. I'm writing. So I'm done. Okay. Thank you so much, Ms. Abigail. We have questions, so I didn't want to to cut you because the network favored us. So I wanted us to all see. So we are just going to see how to take the questions that we need to take. So the first question is from Promise, saying by my training, you will have to wear gloves before changing the bed sheet. So I don't know, Ms. Abigail, if you will answer, or I can go ahead. Let me saliva thing that will make you come in contact with fluid. Very important. That's one. And two, when you are removing the used bed sheet too, like she said, you have to be very careful the way you do it so that the bed sheet does not come in contact with your scrub that you use and further contaminates the environment. So it is not at all, promise. You can do your own research. For laying bed, for making an unoccupied bed with clean and new bed sheets, you don't need hand gloves, except what it's not compulsory. Okay, so the next person is the next question. Okay, are gloves not necessary at this point? That's the same thing. That's the same question we already took. Gloves is not necessary. It's not a must for you to use gloves. It's not necessary for you to use gloves when you are laying a bed, when you are making a bed, an unoccupied bed. Am I correct? Yes. Yes. Okay, so now someone is saying, people like to use hand to lay bed spread or remove bed spread after discharging a patient. All right, now, after discharging a patient, okay, let me respond to that question. After discharging a patient, you can assess the bed. If the bed is soiled, it's only right for you to use your hand gloves.
Okay.
Am I correct? There's something we call when necessary or if necessary.
Yes.
So you use your initiative. Have I answered the question?
Thank you, Hannah. Thank you. So it's just the same thing as I said. If you have to come in contact with fluid or something, don't forget that aside the hand gloves, you also wash your hands. That's another thing. You also use your hand sanitizer. So if you sanitize your hand, it's free from germs. And if you even think that you have contaminated it, you have in the process of doing whatever you are doing, all you need to do is just to reach out and get your hand with the sanitizer, rub it on your hand, any germs that is there. So that is very important. Again, initiative is very, I remember Officer Wilson said that Thursday, that you have to use your initiative sometimes because most of these things are not cast on concrete. But it's important to note that anything that's got to do with fluid, use your gloves. That's number one rule. Use your gloves. Saliva, anything. Someone having epilepsy, you know, you can, or someone having anything that will result in fluid coming out. Please use your hand gloves. But anything that's not got to do with fluid, like maybe the bed, you know, with new bed sheets, clean bed sheets, of course not. It's not. It's all gloves. It's not necessary. Now, what is there? Someone said another question. What is it? Okay, someone said, I was told it's always important to lay bed with a partner. It's always important to lay bed with a partner. That's very correct. It's important to lay bed with a partner, but you can still lay a bed without a partner. You see why we say that this thing, you can still make the bed just as you've seen her do. She did it alone. So if you have learned the skills, you know how to do it. It's easy. You can lay the bed yourself. But at the same time, if you cannot lay the bed by yourself, that's you alone, get a partner. Just reach out to your colleague, you know, you can stand and lay the bed. But if you can do it by yourself, then you write on, it's not also cast on concrete, I guess that's okay. So why is it important to make envelope type of laying bed? You see this envelope bed thing. This envelope bed thing, over the years people have been asking, why am I? The last training we had, I had to say, you waste a long time, you lay the bed, you try to make the envelope corner, you try to do this, and I just laughed because these things are taking time, you're learning. By the time you are a master of what you do, it's just a walkthrough for you. You do it and do it. Practice, of course, they say makes perfect. So when you keep practicing, it becomes a part of this thing. Nurse Abigail is doing, she's taking her time because you need to see the steps. But if she was doing it in the normal situation in the hospital as she does, it's just something that will not take her time because nobody's actually learning any step and then she goes. So now it is important that we make this bed because one, it adds beauty. That's one thing. If you walk into a hospital with beds, for instance, they're coming for inspection, maybe to come and check what's going on or coming for inspection. Laying your bed using the envelope method to lay the bed alone gives it a kind of beauty. It just refreshes. And you know, you are dealing with patients, you are dealing with vulnerable people. So you have to make them feel happy. You have to beautify the setting with which they are so that they don't feel left out, like, oh, I'm not in my house or something. Just for aesthetic reasons and to make it beautiful, yes, we do that. And also, like Nurse Abigail said, you can the patient can put whatever they have, I guess. Yeah, yes, maybe for safety. Like some do, they just stuck it there and remove their earrings and just put it there. So it's important. And this particular envelope making is a skill that is very, very important. Please, let's take note of that. For CNA, certified nursing assistants, for CHCAs, very important for the home health care aid. All this, one of those skills is for you to be able to make your bed envelope. It is one of the skills that is tested. Even you have all right, so at this point, please, I've seen the time. I would like us to take our break, just the 10 minutes, the normal 10 minutes we used to have. We've been notified that it's break time. So Let's take the 10 minutes and then we will be back. We'll start exactly 7:05. 7:05, we should be back. Please, are we together? Hello?
Yes, ma'am.
Yes, ma'am. Yes, ma'am.
So let's take our break, please. We don't want
Thank
to
you.
have let's stretch our legs. Thank you. Please, can you mute it?
All right, I've said hi. You said you want to hear my voice, so I've said hi and hello to everyone. This is Sarah from Ghana.
Is that your letter?
No, this is Sarah from Ghana.
Okay, Madam Sarah. It's nice to hear your voice because I was saying I don't hear your voice. It means tomorrow I'm just going to take a flight and land in Ghana tomorrow if I hear your voice. So thank you for reaching out. Yes, because I have missed you on the platform for some days when network will be dealing with you. So I'm glad you are here today. Yes. Thank you for coming. Thank you. All right.
You're welcome.
What time are we coming back?
7:05. We just have 10 minutes. Let's stretch our legs and be back. We don't have too much left, at least for today. So let's just stretch our legs. Thank you, Madam Wezi. See my phone, officer. Back to we are back. Are we back? Please, I need response. So I will know that they have not left me in this place. So are we back? Are we together? Like nobody's hearing you. Hello, are we together?
Yes, I'm back. I'm here. Yes.
All right. Thank you for coming back. Let me know people that are back. Help me check the 16. Okay, so 16. We have 10 people still relaxing their muscles. Okay, fine. So like we said, people are still envelope bed making, envelope corner, and so on. Like I said quickly before, because we had some questions that I was attending to. Someone said, this method of bed is hard for me. Can we use our own personal method? Of course not. We cannot use our own personal methods because we are not in our houses. Like we are actually in an official professional setting. So the bed method is actually the recommended bed making method in hospitals professionally to really show that you're a professional. So at home, you may decide not to exhibit your professionalism. You can just lay your bed, however bed. In a hospital setting or in a care home, that particular bed making, envelope corner bed making is very, very important for us to know. Let's not look at the other aspect. The other ones, we can do them however we want to do them in our houses. So we've already talked about the beauty, that it makes it beautiful. And sometimes someone would ask that, why do you even make bed? Why do nurses, certified nurse assistants, certified healthcare assistants, health workers, why do they spend so long? They spend time to ensure that the bedding is arranged well and is laid. It's so because aside beauty, aside the normal thing to make sure you lay your bed, like we teach our children, when you get up, lay your bed, dress your bed, and so on. In the hospital setting, you deal with vulnerable people that are sick, wounded, injured, they have one thing or the other. So every time it's expected that the beddings is not rumpled, it's not squeezed, because any little pressure can affect their skin. Imagine we talked about bed sores and other things. So if they keep sleeping on bedspread that is not laid properly, that is not smoothened, it can affect their circulation, can affect the way the blood actually circulates in the body, and results to bed sores. So bed making is one very important skill of all medical people that are in the health sector. So now let's look at something else. Making an occupied bed. The other one, with those questions we're making a bed that was not occupied, an unoccupied bed. Now we are making a bed. So over to Nurse Abigail. The floor is yours now.
Okay. Show everyone how to make an occupied bed. So before I start, I have to greet my patients. Afterwards, I explain the procedure to her. Then I seek her consent. Madam Liz, how are you doing? I'm here to make your bed. My name is Abidjan. So I want to make your bed. Are you okay with that? Yes, okay. So now I'm going to gather my supply. First of all, I will screen the bed. It's my screen. I'll screen the bed for privacy. Then I will now proceed to go and wash my hand or sanitize my hand.
Okay, thank you, Nurse Abigail. Sorry, I have to, as you act it out, I begin to remember the lessons taught. So let me align it as you act it out. Now, remember, when we have communication, we had talked about your clients, your patients, respect, dignity, privacy. When we had a communication, I kept emphasizing it. And it is one of the qualities that is looked out for when you actually going to maybe have sessions, maybe employment interviews. You could be asked some of these questions. So that's what Nurse Abigail has just done. Privacy is very, very important when taking care of your client. Be mindful of the fact that your client has to have that privacy. And whatever you do, make sure that you don't bring down that person, your client's self-esteem, or the person's dignity should be paramount to you. And communication. Never you do anything on any patient without that patient's consent. Remember, we talked about that. God willing, tomorrow we have the legal aspect of this whole thing. We are going to be looking at it maybe the first 30 minutes or so before we actually delve into the other parts of the practical. So that you don't get on the other side of the law. Very important. It's important. And then don't do what your patient does not give you consent for. So just as you've seen it play out, meet your patients, take very little steps with a smile and all the things that you learn before you even proceed to carry out whatever thing you want to do for your patient. That's very important. Thank you so much. Go ahead, Abigail. Thank you.
So now I will gather my supplies. So these are my supplies here. This is the bottom sheet. This is the draw marking brush, and this is the draw first sheet. So I'll go ahead, which you know I've sanitized my hand. I'll go ahead to wear my gloves because I'll be stripping the bed from side to side.
Okay, and you've observed the bed is soiled, I guess.
Yes, this is because there is a patient lying on it. That's why it's an occupied bed. So it's assumed the bed is soiled. So I've successfully put on my gloves. So, Madam Rose, can you see here? One way.
This, Nurse Abigail, can you be a little bit audible? I don't think.
Okay. So, Madam Rose, I want to make your bed now. Are you okay with that? Yes. So I'll be straight the bed from side to side. Then I'll be turning you from one side to the other. So I can carry out the procedure. Are you okay with that? So you start from the top. You start stripping the bed from the top. Then to the side. And then to front. Then from the top, you roll the bed this way. You hold it this way for patients. So I've rolled it to one side. So I'm going to turn the patient this way, and I'm going to turn it. Are we together?
Yes.
So I've successfully stripped the bed, and then I'll be soil linen in the soil linen in. Are we together? Yes. So it's
Yes.
assumed the bed is sanitized already. So now I'm going to take off my clothes this way and then discard it. So I'll get my top sheets. Then I'll fold it this way. So I'll roll the bed linen. I make sure that I align it properly so that it will be equal. While doing that, you allow your scrub to come in contact with the linen. After that, I'll pick my draw Macintosh. Put it this way. Then I'll roll it to the of the patients. Making sure that it's properly arranged. After which, I will now pick my draw bed sheets and do same. Are we together? Yes. Make sure that it's properly arranged. So now I'm going to talk in from the top. You take the mattress up this way. And you tuck it in this way. Same thing, I'm going to repeat the method I use and then do the envelope corner. You make the triangle this way and then you tuck in the bed sheets this way. Then make sure it's properly tucked in. Then you now make the envelope corner. Can we see? You can put your belongings here, whatever you wish to put here in the. Then I will now go ahead to tuck in the bottom sheets this way. Are we together?
Yes.
Then I'll be triangle shaped. Can we see? Then I will tuck it in here to bring out the envelope corner. Can we see? Then I will tuck it in. Finally, this way, I'll tuck in my draw Macintosh and draw bed sheets. At this point, I'm going to turn Madame Rose to this side of the ready-made bed. So, Madame Rose, I want to turn you to this side. Are you okay with that? Okay. Slowly. 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 So, I'll bring out the bed sheet from the top. Remember, don't allow your scrub to come in contact with the bed sheets. So you tuck it in, you do the same, like you did with the other side. Making the envelope corner. Then I'll bring the draw marking touch out this way. Draw the sheets this way. And then I'll tuck in the bottom sheets this way. Making the envelope corner same as the other side. Are we together? Finally, I'll draw the sheets. On the bed. Mrs. Jones, I'm going to take you on John. So I want you to be comfortable. So is there anything else you'd like me to do for you, Mrs. Jones? Okay, I'm done. Thank you. So I will now constrain the bed. Then I'll proceed to touch my hands. So that is all taking on paper. Thank you.
Thank you so much, Miss Abigail. That I always love to look at this because up until I actually went delve deeper into the health sector, I used to wonder how you can make a bed with a person lying on it. It's always the most captivating part of this whole training, you know, the part of being able to lay a bed, rest the bed while the person is still lying on it. There's some form of, I used to think there's some form of mystery attached to it. But over time, with my knowledge and, you know, with time, I got to know it firsthand how it is done. So thank you very much, Ms. Abigail, for that. So what do we have next? We have positioning and turning the person in bed. So now we want to look at that particular aspect of positioning and turning a bedridden patient in bed. Please, can you find out if there's any question for me, please? No questions so far. Okay, so that's to say you don't have any questions. So now, we talked about bed sores. You know, we said when we talked about pressure points in the body, and we did say that you have to, if you have a bedridden person or a person that is bedbound, you have to keep turning the person, you know, into different positions, you know. So now, before we do that particular one, I would want us to look at these three very important positions that we need to know, because in the course of doing our jobs, it can be said, so we can just be, they can give us maybe an instruction to tell you as a CAC, turn that patient, place the patient in a supine position, and you don't know, you don't know. So that's part of what we want to look at. We want to look at the three very important positions, the lateral position. I think the first aid officer Wilson did that, but due to network, there may be people that may benefit from that today also, if network obstructed them or something. So there are three major positions. We have the lateral, the supine, and the prone. Three positions, lateral, supine, and so let's just look at this. Let's see the position. So Let's start from the first position, which is over to you. Okay. So I'm going to show you the three positions like she has mentioned. So I'm going to show you how a patient can lie down in a supine position. So, Madam Jones, I want to turn here because I noticed that you've been lying along. So it's necessary I change your position in order to prevent you from lying down in one particular position for too long. Are you okay with that? Mrs. Jones has been lying down from this particular position for a long time. So now I want to put her in the supine position. So this is what I will do. Mrs. Jones, I'm about to make you lie comfortably because you've been lying in the position for too long. So I'm about to turn you on. Are you okay? Yes, okay. So let's start. So are we together? This is called the supine position. The patient is lying flat with her back facing up. So this is what we call the supine position. So now I'm about to change the position of my patient, assuming she has been lying down in this position for so long. So I want to change her position. So we do this every 2 hours in order okay, let's assume she has been lying down in this position for too long. So I want to change her position. So, Madam Jones, how are you doing? Okay. I'm here. I want to change the position. It's asking you to lying down. So I want to make it like
Please, everyone should move their mic now. What's this now?
So are you okay with the hairs? Let's take it this way. And my hand flex this way. Then I'll put my hand under her shoulder this way. And then turn her this way. Can we see? Yeah. So now it's assumed Madam Rose is lying in the lateral position. Madam Rose is lying in the lateral position, facing this way. Are we together? Yes. Okay. So now, this is the lateral position. I want to change Mrs. Rose's position from lateral position to the prone position. So, Madam Rose, how are you doing? Fine. Okay. I'm here to change your position from lying this way to lying in the prone position. Are you okay with that? Yes. Okay. First of all, I'll have you shift on this way. So now I will have a leg flex this way. Are we together? Then our hands this way. I'm going to be turning your other nose. You put your hand this way. You turn her this way. Can you see? Are we together? So Madam Rose is lying in the prone position. Are we together? Okay. So this is how to place the patient in different positions so as to prevent pressure sores. So we have various pressures on the body. So we turn the patient every 2 hours to ensure proper circulation of blood in the patient's body. So thank you very much. All right, thank you, Nurse Abigail.
Thank you, Nurse Abigail.
We just ask a question, and that question is that position where someone stays after CPR, the person is recovering from CPR, like after CPR, maybe having done the CPR, then you feel the pulse coming, the person beginning to breathe, and that person is placed in that position. Now, there are two responses. I want to know the name of that position, and two, that is, I want to know what it is called, and two, I want you to tell me which of the three positions is that person supposed to be placed in, recovering from a challenge, maybe from whatever illness, after CPR is carried out. So who is going to help us? Now I mute the mic because I don't really look at the recording now. So I permit answers, please. Who wants to talk? Or you can just type it for me in the chat box because I'm going to be on it. First, that position, what is it called? We learned it the first took us through that. And said after CPR, there's a particular position the patient is kept. So please, the first person to type it in the chat box, I'm going to look at it. Then the second is which of the three positions is that particular one called? Which of the three? Is it the lateral? Is it the supine? Is it the prone? Which of the positions is the same as that particular position the person is kept when the person is recovering from CPR? So please, someone should okay. I've checked the comment. Let me know the first person to please drop that comment. I need to know. So thank you. Thank you so much, Sabi. What do we have next? Okay, we have bed bath. That's what we actually have now, bed bath. But I'm saying it as if we could. Yes. Okay. No, Sabi, there someone is saying, what if the person refuses to change position? You know, we've been talking about challenging our behavior in challenging behavior. That's people that are posing as challenges. They don't want to eat this, they want to take this,
they want to do this. Please, I need to know the first person. Okay, Mildred, that gave me the answer to that question. Please, the first lateral position,
Yes.
right? No. Yes, Mildred said
Lateral position.
I needed another. Yes, that's correct, Mildred. Thank you
It's
so much. So
lateral.
that's
Yes.
part A of the question. And then, okay, all right. But in this order, okay, I've seen Kate. That's good. Recovery position, Susan. Recovery position. Thank you, thank you. Lateral, lateral, and so on. That's beautiful. What? Yes, that's good. So it means everyone is just going to clear distinction this time around. That's what we thank God. Okay. Fine. So what takes me back that someone's microphone is on, and this is not good. This is not good. All right. Assisting with giving them back. I think we can look at that. We can run that because the fact is I don't want to take people's time more than so. Can we do that? Yes. Let that be the last skill. So we will take the rest over to tomorrow. So over to you. All right. Okay. Sorry, please. Someone asked a question that what if someone doesn't want to change position? Of course, like I told you, you have these issues. So but communication is important. Ensuring that the client, your patient understands what you actually want to do. You see where we were talking about those things. Connecting with your patients, building that rapport, building that connection, so that if you want to actually have an act on a person, you want to actually do something, maybe turning, let the person understand the importance of being turned intermittently to avoid bed sores. This is we cannot overemphasize that. Because if you don't keep turning them, it results to bed sores. I even gave you some instances as to what happened to my grandmother so many years ago. So if you have such challenges, make the person understand the need for the person to be turned. And with connection, effective communication, you have built that rapport. The person knows that you have his or her heart. It wouldn't be much of a challenge. You don't want to connect with someone, and the person knows that you are truly there to take care of him or her. You are truly looking out for his or her well-being. Then it wouldn't be much of a challenge for you to convince such person. But again, I said, if you have a situation you cannot convince a person, all you need to do is to reach out to the next person. Like certain things, it's like I'm trying to talk to Madam Ubeze now, it's not working. I can decide to talk with Mildred. I can decide to say, Mildred, what's happening to Madam Ubeze today? Mildred, please, can you help me talk to Madam Ubeze using your own, another different approach? Let's see if she's going to be ready to go. So that's how it works. Sometimes people don't like to hear from one person, but perhaps the next person could use another approach or method that will be more appealing to that person. These vulnerable people, you have to follow them gently. You don't have to outball. So I want to turn you. You don't want to turn. You don't, okay, remain like that and you walk out. After all, it's for the person to follow them gently with patience. So I think, sorry, please, Nosabike, please go ahead. Okay. The next skill we are about to take is bed baths. Bathing a patient in bed. So let me inform the patient. Let me seek her consent. How are you doing? Yeah. So let me gather my supply.
So these are my balance. First of all, I have a wash towel and a dry towel. Then I have the bath towel and also the under towel. Then here I have 2 bowls containing water. One is soapy water and 2, the other one is clean water. So I'm going to ask patients to check if the water is okay for her, whether it's at right temperature for her. So, Madam Rose, then I would like you to check if the temperature of the water is okay for you. You okay? So first, I'm going to see you from here. That's what I'm trying to do. Okay. Thank you. Okay, close up. Okay, so I'm going to provide privacy for my patients. I will screen the bed. So now I'm going to go in with the clean water. First of all, I'll ask my patients if okay. It's important, it's very so like I said, I'll ask my patients if she would like soap on her face, because most patients don't like soap on their face. So, Madam Rose, I want to ask, would you like soap on your face? Okay. So now I'll go in with the clean water. Let's see. All right. So now I'll go in with the clean water. And squeeze. Then I'll start with the eye, cleaning from inside out. This way. Then I'll fold the towel this way. Then same thing goes to the other eye, inside out. I'm doing it this way in order to prevent infection. So I'll wipe this side like this to the chin. Turn the towel this way. I'll wipe it this way to the chin. Then this other side, I'll go in like this way. Then I'll go in this way. Then clean the ear this way. Move the towel this way. I'll wipe back of her ear this way. Also, this other side of the towel, I'll clean her ear this way. Are we together? Yes. Then I'll come to this last side and then clean the back of the ear this way. Can we see? Then I'll soak the towel. Assuming I'm improvising, I'm using a different towel. So I'll soak it inside the soapy water and then I'll squeeze it. After squeezing it, I will now clean the neck. Madam Rose, I'm going to take your chin off. So I will now clean the neck this way. Are we together? At this point, I'm going to dry the neck with my towel. This way. After that, I will now apply my under towel. This is to prevent the bath water from coming in contact with it. Madam Rose, I'm going to place this towel under the shoulder and your arm. Are we together? So now, this is the soapy water. I'll dip the towel, I'll squeeze. And then the arm. Bend the arm properly. Are we together? I wipe in between her fingers. Can we see? Then I turn her palm this way. Then I wipe the armpits. After that, I will now use my dry towel to dry her arm. Are we together? So, I'll dip the towel in the soapy water and then squeeze. Then I will now clean her chest. If it is a female, you clean under the breasts. Because under the breast can harbor bacteria. Then I now clean the abdomen. Are we together? Try as much as possible not to expose the patient. Then I'll take my dry towel and then I dry. Are we together?
Yes.
At this point, still using my soapy water, I squeeze down to the top. I clean this way, and then this way. Then I pick my white towel and then dry. Same thing is on to the other side. Are we together? So now I'm going to turn my patients to the other side. Madam Rose, I'm done with this side. I want to turn it over.
Question.
So that I can.
There's a question.
Thank you, her. So I'll hold her this way and then turn her this way. Are we together? By this time, I'll place my under towel properly. I want to clean her back. Still using water. Squeeze. And then clean her back. Are we together? Then I will dry. Same will be done. Still using my soapy water. I will clean. Okay, I'll clean her thigh, her legs. After that, I will dry. So now, I'm done with cleaning Madam Rose. The last part will be the perineal area. That part, we are going to be using a separate under towel. And then a separate wash towel and a dry perineal area. Are we together? Yes. So at this point, I'll be asking Madam Rose if she will be willing to allow me to take care of the perineal area, because some patients, they don't like or they don't feel comfortable with the perineal care. So now, Madam Rose, so Madam Rose says she's not okay with it. So at this point, I'm going to hand over the towel to her for her to wipe the perineal area herself. Thank you so much, Nosabiya. Thank you. So after that, I will now place Madam Rose wiping the perineal area. I will now place her in a comfortable position, thereby removing the under towel. So Madam Rose, I'm done. I'm going to place you in a comfortable position. Okay. Thank you. Thank you for that beautiful.
You see, thank you for telling us how to clean. But we have one challenge, though the patients, it's important that we listen to what the patients say. Okay. So I crave your indulgence, my distinguished professionals. I just want Nurse Abigail to show us how to clean the perineal area. You know, when I was teaching, I told you that most of the infections we contact, especially as ladies, is due to the fact that our hygiene, you know what I mean by that. Hygiene comes into play. Because of the nature of female anatomy. So you have to be extremely careful. So when we are cleaning, Nurse Abigail would have done it, but the patients said otherwise, that she do it herself. But it is important for us to just look at the steps. Like we are cleaning, we clean from up, down, from up to down. So that I don't take infection from your anus down across the. So this is very important. So I think just Nurse Abigail, just take the last few minutes. This should be the last skill for today. I don't intend to take too much of the time of the participants. Just show us what to do. And in this case, like Nurse Abigail already said, we do not have to fully use, we don't have to complete all those procedures with just the one, that's one wash towel and the one dry towel. As many as you can have up to 4, but for the purpose of this training, we just put the 2. So our time, we can just use one and show you. So intermittently, especially when you are dealing with the sensitive areas in the body, like Nurse Abigail said, we have to use towel and another dry one, just as she said. So we are going to see how she will just demonstrate and show us how to clean. For us ladies, we need to know so that we can also teach others that we wish to learn from us. So over to you, Nurse Abigail, just mock presentation of that.
So I'm going to
want you, Madam Rose, to remove the trousers for us to see what we shouldn't see. And so
so I'm going to teach you how to take care of the perineal area. At this point, I'm going to wear my gloves. If I was putting on, I would then get another one because this is the perineal area we are talking about. So now, use water. I use the wash towel.
Let's assume
yes,
another water.
Then I will squeeze. Then I said, Madam Rose, remember at every point in time you seek, and then you explain the skill to her. Madam wants to clean your perineum. I'm going to flex her leg this way and then flex her leg this way. So I clean up, wipe this way from top to bottom, thereby wiping the lab to bottom. Are we together? Yes. Then wipe it this way from top to bottom. Are we together? Then also yes, there. You need to wipe very well. From the towel aside in the soapy water, then I use towel to dry. Drying this way, same way I use the soapy water. from top to bottom. Yeah, majora. Same way I would do to the other side. Then I now wipe the middle. Later on, I turn the dry towel this way and then wipe the anal space. Are we together?
Yes, we are.
After that, I will now rub her leg this way, making her comfortable. So,
and I mean, it was the number 21. Wow, that's nice. 17. So the others have actually joined us. So do we have any question or any contribution? Like I like to tell you, nobody's an embodiment of knowledge. Regardless of how long I have done this. All right, thank you. I can see questions. This is funny. I've had these questions occur over and over again. The question is, I hope men will take care of men. Yeah, men will take care of men. Is it male to male? Okay. Please explain that. Is it possible for a male to take care of a female's perineal area, or is it possible?
It's not possible for you to choose. Whichever staff is on duty, whether a male or a female, you must agree to the fact that the staff is to handle that perineal space.
In some context, you know, she's just being very sarcastic so that you can laugh. The fact is, most men, if I am a woman, except I am in the labor ward, those of us that have put to bed, you will understand what I'm saying. In the labor ward, you don't get to know who actually delivers your baby, because when the labor starts, you will not mind whether it's a man or a boy, or you will understand. But most of us, you will not look at those things. But in this case, it is important that you take into consideration your clients' your patient's preferences, you know, like we talked about. So, Nosabika was only being funny so that you can, you know, but you have to give, you have to listen to what your patient wants. For instance, if this lady now says, she doesn't want, oh, no, maybe a male person comes, and the person is like, okay, I've cleaned you, you know, I want to, no. If she is not comfortable with it, then it's immediate effects. That man has to be replaced with a woman that makes her feel comfortable, because the bottom line is the patient's welfare, well-being. So if the patient is not comfortable with it, then that's a no contest about it. It is the patient you are looking out for. So what they want stays, just like you seek their consent in that's all through the steps that you take, you seek their consent. So if you seek their consent, that is very sensitive, of course you need their consent. So that is justice. It has to be male to male, except people that don't have reservations. They don't have any issues. There are some people like that. They wouldn't mind, maybe because of the illness, they don't take all those things. They just want to, what has to be done should be done, and so on and so forth. Someone says she has a question. Okay, if you have a question, please type. Okay, someone is saying, what? I have a question. Okay, Uchenna, Juliet, I haven't seen any question. You just said I have a question, so I don't know what the question is.
Good evening, everyone.
Okay, good evening, Juliet.
Good evening. My question is, when Nurse Abigail was talking about taking care of the perineal area, as it's taking the permission from the patient, she like asked, using that terms, perineal area. Is it possible that we use a normal term like, please, ma, I would like to take care of your private part or your vagina, because I don't know if it's allowed, because I feel it's not every patient that will understand or know that term or the language.
Yeah. So, Nurse Abigail, go back to you.
Let me respond to that question. Is getting on meds. That's your question.
I have a question.
Thank you very much.
I guess that's okay. All right. Mildred, you said you have a question. Please go
Yes.
ahead.
Because it's a bit funny because I talk about the religion, the Muslims. Because even saloons, I discovered that their women, both male and female, work. They don't. That's why, I live in Abuja. I see that a lot of saloons, they normally have a demarcation where when they come in, they can't see them. So now, when it comes to medical, this taking care of the perineal area, I doubt if a Muslim man will allow a female nurse to come and clean him up, or a Muslim woman will allow a male nurse to come and clean her up. So because I know that you people have dealt with such things. So I want to know how those situations are being handled. Thank you, ma.
Thank you for that question. You are perfectly correct. You are 100% correct. It happens. On a very fine day, anybody that has really those principles like that, you don't just will, aside the facts of religion. But like we got to say, there are certain things that can be done. If a male person is actually on shift to take care of a female patient, it depends, like I'm telling you, like we said, it depends what individual. That's where person-centered care comes in, channeling your care to meet that progress that is the person's on the person. So if it depends on what the patient actually wants. If the patient has resistance, that's why the patient's preference is very, very, very important. There are some people I have over time and all that. I've seen there are people that don't actually care, that like they are, it's just like even in a hostel where we have females, there are people that are very, very careful about exposing themselves. I mean, female hostel, that's just their personality. They don't feel comfortable. Okay, let alone a person of the opposite sex. So it happens. So what happens is, if it is observed that that is not the preference, because of course the patient will frown at it or will disagree. That is where communication comes into it. Before you do anything, you have to say it. There's one of the videos, I will stumble on it. I should, because of this question, somehow I'll drop that video so you'd see. Just the fact that the male nurse went in, not even take care of perineal area, but that day was not a too good day for the patient. So when the male nurse knocked, it was his shift to enter for the first time. Just seeing that it's a male nurse alone puts the patient up, and she now she got so uneasy and began to scream, those normal things. And at that point, the matron was able to step in at that juncture and then ask the male nurse to go. So she continued from there. So these things happen. So if the patient disagrees that she's not comfortable, vice versa, male too. Medical. So sometimes these things have kind of been nipped in the bud because of looking at the total well-being of the patient involved, seeing life as life being paramount. All these other things are minor. So, but that is right. The patient is not comfortable with it. These are things that we have to either assign another person to, of course, assign another person to her, or she does it herself. Just like Rose said that no. So in such a situation, if it's someone that can still do it for ourselves, we'll say, thank you, I would, depending on the state of the person, shake the head or something. So no, the person doesn't want that. And you respect that person's preferences and you progress. You continue doing other things that you want to do. So I think I should have kind of answered you, Mildred. Are you okay, Mildred?
Yes, thank you so much. Thank you. God bless.
Bless you too. So I think with that, no other my phone right now. I haven't seen any question. I wouldn't want us to stay for too long. If you have any question, bring it tomorrow or you put it in the registered participants group. That's why we have the group there. You can just tell your views and maybe drop your contributions that I can also learn from you. So today we have come to the end of today's training. Where way to wear no smart. So all these things, tomorrow is going to be another very beautiful day. Please, however you do with network, however we two are going to do, we just have to, because tomorrow vital signs, which is one of the key skills, another key skill, we're going to look at vital signs, we are going to look at transfers, how you can transfer a patient from the wheelchair to the bed, from the bed, and or everyone patients. In fact, we are just wonderful people. For that patients alone, that first time we started network locating, you were able to bear with me, bear with network, and you stayed up until now. Thank you so much. I trust that by the time our results come out, wow, will come out as the best ever for working with divisions and BCC. In Jesus' name. Nobody said amen. That means
Amen. Thank you.
All right. So thank you so much. So our FAB management and integrated services and smart.
All right.
Okay, thank you, ma.
All right, doctor.
Thank you,
All right, doctor, Mrs.
though I came
Dorothy.
late.
All right, Dr. Mrs. Dorothy. Okay, you have something. You want to say something?
Yes. I don't want to say. I just remembered something that I may forget. Ezinwa, is Ezinwa here? Ezinwa Loretta. Okay, that's one person I have not seen at all. I just wanted to confirm if she's here. Please go ahead, sir. Thank you.
All right, Dr. Mrs. Dorothy, it's another wonderful time. We appreciate you so much. I appreciate you. Whenever we have trainings like this and we beckon upon you, you're always there and you've never disappointed. And for our nurse Abigail and all the team members, you have been wonderful. We appreciate you so much. Thank you for, giving our participants the value of the money they paid. And for our participants, we appreciate you so much. Thank you for the time, despite how network started, but we were there from beginning to the end. I want to wish us a lovely night rest. We'll meet again tomorrow. Good night, everybody.
Good night, sir. Thank you so much.
Good night, sir. Thank you.
Thank you. Thank you so much.
Good night. Good night. Good night.
I appreciate it.
Good night.
Thank you, Dr. Dorothy.
Good night, everyone.
Good night, ma'am.
Good night.
Good night. Bye.
Bye. Madam Dorothy, bye.
Sister Daisy. Good night.
Mrs. Jovita, good night.
Yeah. Good night. See you
Bye.
tomorrow.
See you
Bye.
tomorrow. Sleep well. Bye.
Love you. Bye.
Good night, everyone.
Bye, everyone. Good night, everyone.
Bye, everyone. Enjoy your sleep.
Good night, Dr. Dorothy. Thank you.